Imagine a virus silently spreading among us, infecting millions without making headlines. No media frenzy, no global panic, but it's there. It targets the most vulnerable, children, the elderly, and those with weakened immune systems. What if I told you this virus has been hiding in plain sight for decades, overshadowed by more infamous names like COVID-19? This is the story of human metapneumovirus, or HMPV, a virus you might not even know exists, but one that could be closer to you than you think. Stay tuned, because in the next 20 minutes, we're uncovering the hidden dangers of HMPV, its surprising similarities to COVID-19, and why it's being called a silent threat to public health, new origins and mystery. HMPV was first identified in 2001, but scientists believe it's been quietly infecting humans since the 1970s. Unlike COVID-19, which created a global health crisis, HMPV has slipped under the radar, silently causing respiratory illnesses every year. This virus doesn't make a lot of noise, it doesn't spark pandemics, but it fills hospital beds, particularly during the winter and spring season. Its symptoms like cough and fever are so ordinary they're often mistaken for other illnesses like the flu or RSV. Here's the unsettling truth. There's no vaccine for HMPV, no targeted treatment, and little public awareness. Yet, it's one of the most common causes of respiratory infections worldwide. Transmission and seasonality. HMPV spreads much like COVID-19 through respiratory droplets when we cough, sneeze, or even talk. But unlike COVID-19's year-round presence, HMPV peaks during the colder months, especially late winter and early spring. Imagine this: one person with a cough in a crowded room can unknowingly pass the virus to several others. By the end of the day, it's already spreading through homes and schools. But why does it prefer colder seasons? Experts point to indoor settings with poor ventilation as the perfect breeding ground for viruses like HMPV. The virus waits for these conditions to thrive, infect, and spread. Symptoms and risks. The symptoms of HMPV, fever, cough, nasal congestion may seem mild at first, but in severe cases, it can lead to bronchiolitis or pneumonia, especially in young children, the elderly, and those with pre-existing health conditions. What's alarming is how similar these symptoms are to COVID-19. This overlap often leads to misdiagnoses, delaying critical treatment. Numbers don't lie. HMPV is a leading cause of respiratory-related hospitalizations in children under 5 and adults over 65. Yet most people have never even heard of it. And unlike COVID-19, which has vaccines and treatments, HMPV leaves doctors with few options. Managing symptoms is all they can do. Why it's a silent threat? So why isn't HMPV making waves like COVID-19? It doesn't spread as aggressively, and it doesn't cause global emergencies. Instead, it quietly infects and hospitalizes vulnerable individuals during its peak seasons. This stealth makes it incredibly dangerous. Public health systems are already overwhelmed by more high-profile viruses like flu and RSV, leaving little room for HMPV on the radar. But ignoring it doesn't make it any less of a threat. Let prevention and awareness. The good news? While there's no vaccine or specific treatment for HMPV, there are simple ways to protect yourself. Washing your hands, wearing masks in crowded spaces, and staying home when you're sick can significantly reduce the spread. For healthcare systems, raising awareness is critical. Testing for HMPV should become as routine as testing for flu or COVID-19. Faster diagnosis can lead to better patient care and outcomes. And call to action. HMPV might not make the news, but it's a virus we can no longer ignore. It thrives in silence, affecting the most vulnerable among us. Now that you know the facts, share this information. Let's bring HMPV out of the shadows and into the spotlight. Together, we can push for better awareness, better testing, and ultimately, a safer future for everyone. Stay informed, stay safe, and remember, knowledge is the first step to prevention. If this video informed you, hit like, share it with others, and don't forget to subscribe for more eye-opening content.